Cohen with the Duke Endowment.
I'm Cindy Sutter O'Neill with Child Trust Foundation.
Nicole Gardner-Nebler, University of North Carolina.
Jill Singer, Department, Division of Public Health, HHS, Early Intervention.
Barbara Leach, Family Support Network of North Carolina, University Office at UNC Chapel Hill.
Mati Ferrer, Hispanic Family Center, Catholic Charities.
Carla Betrego with Prevent Child Abuse, North Carolina.
Cindy Dewey with the Department of Public Instruction.
Rhonda Rivers with Leaf Spring Schools.
Tina Sherman with Moms Rising.
We're having trouble with our pass microphones, so everybody's gonna have to project. Remember the drama class in freshman year? I don't know. So here's our recreational elective statement. It's tiny, sorry, but it's just broken up into 10 people, which is what you have on the stage.
Since its adoption in 1893, our state motto, "To be rather than to seem," has both inspired and challenged North Carolinians to go beyond just speaking our values and truly live them. We pride ourselves on being a state that is a leader in creating opportunities for people to live with dignity, realize their potential, and achieve their greatest dreams.
Yet current and historic laws, policies, and practices, both official and unofficial, have created and maintained widespread barriers to opportunity and success for children and families of color.
We can go to my. We actually had one, we just couldn't figure out how to turn it on.
Does this work?
Yes.
All right.
Today in North Carolina, too many children from all racial groups are not meeting a critical developmental milestone, reading on grade level by the end of 3rd grade. However, there are vast differences in outcomes between racial groups, with 52% of white children meeting this benchmark, while only 22% of Black and 22% of Latinx children do. These disparities in outcomes are the result of systemic barriers, both current and historic.
Ensuring that all our children and families have high quality child care and early education, effective public elementary schools, high quality health care, and well-paying jobs that can support a family is the key to improving 3rd grade reading proficiency and the key to prosperity for all of us.
To get there, Pathways focuses explicitly on racial equity, since race in America plays such a large role in determining children's life outcomes. This racial equity lens guides Pathways to recommend dedicating more and different resources to support children and families of color and creating systems that work for all.
Leading with racial equity means prioritizing strategies that specifically work to improve outcomes for children of color and giving special consideration to the wisdom and innovation of people of color to develop responses that are lasting and reach all children. Targeted interventions that account for structural racism benefit all children.
The action framework also aims to reduce disparities in children's outcomes based on income, ability, language of origin, geography, gender, or age.
Pathways uses a racial equity lens by disaggregating data so that we can clearly see and address the racial and other disparities in outcomes among groups of children. Ensuring that people of color and white people work together to make decisions about what to prioritize and how.
Encouraging and supporting partner organizations and agencies to lead with a racial equity lens, and convening organizations so they can learn together, support each other, and partner to advance racial equity work for young children.
When our systems work
collaboratively and are shaped using a racial equity lens, we ensure that the best possible future for our children in North Carolina.